Hi, my name is Krista Jones with Arizona State University. Today, I would like to discuss the disparity in child care quality created by the Child Care Subsidy Program. This presentation is designed for the Texas Workforce Commission, but the information is also relevant to legislators, child cares, and parents receiving child care subsidies. The Child Care Subsidy Program is designed to assist single mothers and low-income families in obtaining maternal employment. By making child care affordable for low-income families, mothers are able to contribute to the family income. This program is funded by the Texas Workforce Commission, and it effectively boosts the economy by decreasing unemployment and increases the number of taxpayers. This program also helps to reduce the number of recipients of Temporary Assistance for Needy Families, TAMP, or also known as welfare. According to the Texas Workforce Commission report to the 85th Texas Legislature, child care subsidies have also shown to increase parental wages when tracked over the course of a year. By providing consistent child care, the program helps recipients maintain consistent employment, therefore increasing their wages. As you can see, child care subsidies are beneficial to low-income parents as well as the federal and state governments. However, child care subsidies are not always beneficial to the child. Texas spends over $500 million per year on subsidizing child care for low-income families. This amount does not include the millions of additional dollars spent on the underutilized quality improvement programs currently in place. The funds are sufficient to provide quality care. However, Texas, like many other states, falls into a trap of trying to serve too many families, which in turn reduces the benefit per recipient. We must reflect on the policy implications of high-quality care and decide, would we rather serve more children subpar care, or would we rather reduce the quantity served to provide quality childcare in preschool? When analyzing the effect of child care subsidies on child care quality, Ryan, Johnson, Rigby, and Brooks Gunn determined that families that receive child care subsidies are more likely to choose center-based care. Through further analysis, it was determined that center-based care typically ranks as higher quality than friend or family care. However, a 2004 study found that child care centers that accept government subsidies are ranked as providing lower quality care when compared with child cares that do not accept subsidies. So, to summarize, subsidies open up the opportunity for children in low-income families to attend center-based care. However, when comparing child care centers, centers that accept child care subsidies provide a lower quality of care than those that are solely funded through private tuition. So why is that? The tuition reimbursement rates for child care subsidies are significantly lower than the market value of child care. Therefore, providers are put into a tight spot and, unfortunately, must make sacrifices if they accept child care subsidies. These sacrifices, such as higher child-to-teacher ratios, lower teacher wages, and decreasing supply budgets, often lead to lower quality care for the child. Many studies have linked high-quality childcare in preschool with both short and long-term benefits, especially in children from low-income families. Vandal, Birchnell, and Pierce correlated attendance at a high-quality preschool with academic achievements such as higher test scores in the present and the future. This seems logical, right? Early education is correlated with higher test scores in the immediate. However, these short-term benefits actually continue into young adulthood. Vandal's research also revealed a correlation between quality early education and increased high school graduation rates, as well as higher acceptance into secondary schools. Because critical socio-emotional development systems take place between the ages of 0 and 5, high-quality care is correlated with long-lasting social benefits as well. Attendance at center-based care correlates with economic self-sufficiency in young adulthood, according to a 2011 study by Irtis and Shields. Therefore, providing high-quality care at a young age reduces low-income children's likelihood to remain in poverty into adulthood. Children that receive high-quality early care are also less likely to be arrested for juvenile crimes. Another positive social outcome found in low-income children that attended high-quality preschool was a reduced tendency to exhibit risky behaviors in females. This has strong policy implications as it correlates with lower teen pregnancy rates. Again, high-quality childcare for low-income families reduces the government's liability in the future. Because of the strong policy implications, quality childcare in preschool have been on the national agenda in recent years. If funds are already being allotted for low-income students to attend childcare, and we know that quality childcare and education positively correlate with higher high school graduation rates, higher acceptance to college, lower teen pregnancy rates, and lower juvenile arrests, wouldn't it make sense to ensure that the funds allotted for childcare are being used to provide high-quality childcare and education? In addition to simply providing funds for childcare subsidies, the Child Care and Development Block Grant of 2014 introduced several initiatives to increase the quality of childcare and early education. The Child Care and Development Block Grant set forth new regulatory requirements for childcare with a focus on children's health and safety. This challenged states to introduce programs to encourage and increase the quality of childcare. Another priority of the block grant was to educate parents on quality childcare standards in order to better equip them to make informed decisions when selecting a facility for their child. The quality of childcare is widely dependent on the individual providing care. Therefore, the most effective way to increase the quality of childcare in Texas is to invest in Texas caregivers. In an attempt to invest in caregiver education, Texas has allocated funds to the Texas Association for the Education of Young Children, or TAEYC, for the specific purpose of providing scholarships to preschool teachers. These scholarships enable child care providers and preschool teachers to receive a Child Development Associate Certificate, or CDA. These funds can also be used for courses that apply to associate's degrees in early childhood education. Unfortunately, this program is ineffective at increasing the quality of childcare for low-income families. The Texas Workforce Commission has allocated $1 million for fiscal years 2016 and 2017 to TAEYC, again that's the Texas Association for the Education of Young Children, to assist in the further education of child care providers. And although the program offers increased education at no cost, it is underutilized. Only 85 Texas teachers completed their CDA through this program in 2016. Receiving a CDA is beneficial for the preschool teacher as well as the preschool children in her care. However, there is a glitch in the system that occurs when the employer does not have additional funding to appropriately compensate the teacher for her increased education. Therefore, the newly certified teacher often seeks a higher paying job. This is typically at a facility that does not accept child care subsidies. The cost to the state is currently outweighing the benefit provided to subsidized children in child care. Another quality initiative in Texas, Texas Rising Star, encourages child care centers to provide quality care to children. The three-tiered system ranks facilities according to quality standards such as the amount of director and teacher training, teacher-to-child ratios, indoor and outdoor classroom environments, parent education and involvement, as well as compliance with child care licensing regulations. Child care providers earn bragging rights whenever they qualify as a Texas Rising Star facility. In addition to this public acknowledgement of their quality standards, the Texas Rising Star providers that receive child care subsidies receive an enhanced reimbursement rate. The rate per child increases according to the center's quality ranking, with 4-star providers receiving the highest tuition reimbursement. This is designed to reward centers that make quality care a priority. However, we see another example of an underutilized program and another example in which the cost outweighs the benefit. In this case, the cost to the business to meet the increased standards of Texas Rising Star outweighs the return. The enhanced reimbursement rate increases funding of subsidized children by only 5% for 2-star centers, 7% for 3-star centers, and 9% for 4-star centers. Because the current reimbursement rate is already too low, this amount is not great enough for a business to accommodate the payroll costs associated with the lower child-to-teacher ratio and the increased training hours for both the directors and teachers. The monetary value is simply not enough to incentivize child cares to follow these quality standards. Therefore, this quality initiative does not have a large effect on the quality of care provided to recipients of child care subsidies. Currently, only 29% of students receiving child care subsidies are enrolled with a Texas Rising Star provider. You may be thinking that if a preschool is valuable for low-income children, and child care subsidies and existing quality improvement initiatives are not getting the job done, why don't we focus on universal preschool? The Head Start program is a good option for low-income families that qualify to attend public preschool. However, one often unconsidered byproduct of an increase in Head Start enrollment and other public preschool options is the increase in tuition costs for parents for infant and toddler care. The cost of private childcare is already a strain on many families' budgets. Childcare centers typically serve infants through preschool. The state allows for higher ratios of children to teachers in 3- and 4-year-old classrooms. The increased child-to-teacher ratios allowed for 3- and 4-year-old children equates to lower payroll costs to run preschool classrooms. This helps child care centers offset the higher payroll costs of infant and toddler caregivers. When 3- and 4-year-olds are removed from the child care setting and put into the public school system, child cares must increase their tuition rates for infant and toddler care simply to cover payroll. Let me give you a quick example. The Texas minimum standards require at least one caregiver to every 4 infants aged 0 to 11 months. If a child care operation is open from 6 a.m. to 6 p.m., 12 hours, the child care provider must be able to pay for one teacher to be present for up to 12 hours a day, or a total of 60 hours per week. We'll spread this over 2 teachers to prevent overtime. Even if the teacher is paid minimum wage, $7.25 per hour, the payroll alone is $435 per week. This does not include the other obligations to employers, such as matching the employee's Social Security and Medicare taxes. This is simply 60 hours per week at minimum wage. If the classroom has 4 infants, the Child Care Services reimbursement rate for an infant in Lubbock, Texas is $21.70 per day. Lubbock falls around the median in the state of Texas as far as reimbursement rates. For infants attending 5 days a week at a reimbursement rate of $21.70 a day equates to $434 per week. As you can see, the low ratios required for infants require higher payroll obligations for childcares, and the childcare subsidies do not even cover the teacher's salary. This does not include building payments, utilities, supplies, director and office staff, or even a living wage for the caregiver. This is simply if someone was to be paid to care for 4 babies standing outside, perhaps in a park. The higher child-to-teacher ratio allowed for 3-year-olds, 1 teacher to every 15 students, is how childcare centers are able to pay for the building and supplies and administration. The reimbursement rate is lower for older students, but a full classroom of 3-year-olds would help provide the funds needed to operate effectively. By removing 3 and 4-year-olds from the childcare environment, the state is only increasing the cost of childcare for infants and toddlers. So what do we do about it? We must increase a parent's buying power. Johnson, Ryan, and Brooks Gunn determined that in order for parents to receive higher quality childcare using childcare subsidies, the subsidy value must be large enough to actually purchase higher quality care. Currently, the reimbursements in some areas of Texas are as low as 75% of the average market value. In the city of Lubbock, the infant reimbursement rate is $108.50 per week. The infant rates for private pay care range from $130 to $175 per week. In order to provide and maintain high-quality care, many facilities are forced to not enroll children that are paying with government subsidies. This limits the parent's choice when selecting child cares, and in turn increases the concentration of subsidized children at the facilities that do accept child care subsidies. This creates an ugly cycle. The increased percentage of parents paying less than market value decreases the overall budget of the facility. The decreased budget forces child cares to compromise quality by making financial sacrifices. Therefore, child care subsidies are currently negatively affecting children that attend child cares that accept child care subsidies, regardless of if they are recipients of child care subsidies. As Johnson's team determined, the only solution to break this cycle is to increase the child care reimbursement rates to match the market rate. This is to allow low-income parents equal access to high-quality child care programs. Another reason to increase reimbursement rates to match market value is to increase teacher salaries. Jones Branch and his team determined in 2004 that the quality of care and education in childcare is significantly correlated with teacher salaries. In this study, when teacher salaries were controlled for, there was no longer a significant difference in quality between childcares that accepted childcare subsidies and those that did not. The average childcare provider in Texas is paid only $8 to $12 per hour. It is extremely difficult to keep a skilled employee because of these wages. Because the state does not control childcare salaries, increasing reimbursement rates to match market value is the only way to use state funds to increase teacher salaries. So how do we increase the reimbursement rates of child cares receiving subsidies? That's where you, the Texas Workforce Commission, come in. I propose the standard reimbursement rate actually remain the same. If childcare centers are only complying with the state's minimum standards for child cares, the existing daily rate would remain unchanged. However, if child cares are dedicated to increasing the quality of care provided, they should be incentivized and rewarded with a sustainable tuition rate. Because the Texas Rising Star Quality Initiative is already in place, it is logistically simple to keep the tiered reimbursement system in place. The increase could continue to be issued according to the Texas Rising Star quality standards. Texas Rising Star already performs annual unannounced visits to evaluate performance and monitor classroom environments, teacher interaction, and child-to-caregiver ratios. However, the enhanced rate for 4-star Texas Rising Star providers must match the current market value in order for these centers to provide quality care for low-income families. When discussing the next fiscal year's budget, please consider increasing the child care subsidy reimbursement rate for enhanced rates for the sake of quality child care and early education. Even if this means increasing the reimbursement rate per child rather than increasing the number of children served as the budget increases. Thank you for your time.